Thank you for tuning in. I'm Min Son-hee with Thursday's edition of COVID-19. Infections linked to a conservative church in northern Seoul have spread to at least 11 other establishments, including nursing homes across the country. Now, more than 600 cases have been traced to the church thus far, and in a span of less than a week, more than 1,500 cases have been recorded. I have Kwon So-ah with more on the latest numbers, and our Kim Da-mi with related news on the international front. So, do give us the figures for Korea on this Thursday.
Well, Sunny, we have a slight decline in new coronavirus cases compared to yesterday, but we continue to see triple-digit figures. In the span of a week, Korea reported more than 1,500 cases.
Right. So, and those cases are largely linked to a conservative church in northern Seoul.
Exactly, and a massive rally which many of the Sarangjeil Church members went to over the weekend. And in fact, new cases linked to the rally were confirmed. 53 new cases were confirmed as of noon, with 33 of those again linked to that church. And as epidemiological studies are still underway, we're likely to see three-digit figures for the time being. Today we have 288 new cases, raising the total to 16,346. The death toll stands at 307 with one additional death, and we have 230 more people in quarantine and 57 new recoveries. And meanwhile, some 70% of cases linked to the rally over the weekend are patients above the age of 60, so there is concern that the number of patients in critical condition may rise. Now, if we take a look at our graph, for the 7th consecutive day since here 103, we've been having the three-digit figures, and authorities are stressing this week will be crucial in determining how this latest outbreak will play out. Now, by region, we have new cases mostly concentrated in the metropolitan area, with 135 in the capital Seoul, 85 in Gyeonggi-do province, and 10 in Incheon. And also, as you can see, the whole map is full of new cases, including here down in Busan with 15 new infections. And also, Korea reported a dozen imported cases, as these have been mainly in the double digits for the past weeks, as the global situation is also seeing no signs of slowing down yet. So with that, let's take a look at the figures over the world. 22.57 million cases in total, and 791,000 fatalities with 15.3 million recoveries. And let's move over to the places that have been hit hardest. The U.S. has surpassed 5.7 million cases and reported more than 1,200 fatalities within 24 hours. Our Kim Da-mi will look into more details there later. Similar in Brazil, with over 1,200 new deaths reported. And India also had around 1,000 new fatalities, and in total now at 2.83 million cases. Let's move over to other places. There is a concern here in Colombia which has surpassed 500,000 cases, as this country has seen a surge in cases of some 12,000 new infections in the past day. And those are the figures I have for now, but I'll be back after the government briefing. Sunny?
Right, so thank you for that. I'll see you back at the desk. Now, as I've mentioned a few times this past week, the resurgence of COVID-19 is tangible across the globe. And for more on the international developments, I have our Kim Da-mi here in the studio with me. Welcome, Da-mi.
Good afternoon, Sunny.
Da-mi, let's start with the hardest hit nation, the U.S. then.
Right, like So-ah mentioned earlier, the U.S. is continuing to set grim milestones. And in fact, the virus that didn't even exist a year ago is now the third leading cause of death in the U.S., only behind heart disease and cancer. This is according to Dr. Thomas Frieden, the former director of the Centers of the Disease Control and Prevention. Over the past 3 weeks, the U.S. has averaged more than 1,000 COVID-19 deaths per day. In the light of this public health crisis, the 2020 Democratic National Convention took place online this week. And the situation in the U.S. may worsen before it gets any better. Predicting a spike in the number of COVID-19 cases during the fall season, the CDC says the country's death toll may reach 300,000 by the end of the year. Amid the global race for a vaccine, the head of the World Health Organization warned against what he called supply nationalism. Speaking at a media briefing on Tuesday, the WHO Director General called on countries to share their medical supplies to fight the virus strategically at a global level. He further noted that while there is a sentiment among leaders to protect their own people first, the response to this global crisis has to be a collective one.
Indeed. Now, here in this part of the world, Tami, neighboring Japan is struggling to contain one of the worst infections in Asia.
Right, Sunny. So Japan is not doing any better. In fact, Japanese Prime Minister Shinzo Abe has not declared a new state of emergency, even though there are more new cases now than there were in April when the country's first state of emergency was declared. And new COVID-19 cases are occurring sporadically across the country. So while many of the cases originated in Tokyo back in March and April, there is now a fresh wave of new infections in other regions, namely Osaka. So Osaka reported 70 new cases on Wednesday, the highest figure in the country. In addition, there are concerns that the number of critically ill patients in Tokyo may actually be higher than the official tally, because Tokyo has different standards in categorizing patients by the severity of their symptoms compared to that of the central government. So the local press, including Tokyo Shimbun, is calling on the city to apply standards that are identical to that of the country's health ministry. On top of that, the COVID-19 pandemic has hammered the country's exports and imports. According to Japan's finance ministry, the country's exports tumbled nearly 20% in July compared to a year ago. That's the 20th consecutive month of falling exports, mainly in the auto and the auto parts sectors. Imports have also fallen for the 15th consecutive month.
Those are some very discouraging numbers. Tami, what appears to be as disheartening, though, is the reality that countries that were earlier praised for their response to the pandemic are now witnessing fresh waves just like Korea. Please tell us more.
Right, so let's begin with New Zealand, where the general election has been postponed by 4 weeks due to the pandemic. And the country's prime minister said that the decision was inevitable.
Ultimately, the 17th of October, in approximately 9 weeks' time, provides sufficient time for parties to plan around the range of circumstances we could be campaigning under, for the Electoral Commission to prepare, and for voters to feel assured of a safe, accessible, and credible election.
In fact, the pressure had been mounting to delay the vote amid the resurgence of COVID-19 infections in Auckland, the country's biggest city, after 100 days of being virus-free. And over in Hong Kong, the government postponed its upcoming elections by 1 year, citing the city's worsening COVID-19 outbreak. But of course, there were immediate accusations that the pandemic was being used as a pretext to suppress democracy. And Vietnam is also on high alert after reporting its first locally transmitted case in 3 months. Vietnamese health authorities said that the patient is a 57-year-old man from Da Nang City who reportedly didn't leave the city for a month. So in total, Vietnam had reported 500 cases and 26 fatalities. Although the country reported 0 COVID-19 case on Wednesday, local health authorities remain on watch for more unexpected cases.
And hopefully that count stays at 0 in Vietnam. What is the situation in Europe like, Tami?
So moving on to Europe, actually the pandemic has prompted Germany to declare almost all of Spain a high-risk area. Only the Canary Islands off the coast of North Africa are excluded. The declaration does not equate to a travel ban, but it is expected to deal a blow to tourism in Spain, which usually gets millions of visitors from Germany every year. And France has declared its capital, Paris, and the port city of Marseille as high-risk zones last Friday. The country is trying its best to avoid yet another shutdown. Instead, the country is beefing up its enforcement of mandatory mask wearing even at workplaces. The Spanish region of Galicia has banned smoking in public places. It's issued a blanket ban on smoking on streets and in public places, including restaurants and bars, if social distancing is not possible.
All right, Tami, thank you for that extensive coverage. Hope to see you again soon.
My pleasure.
Right, we turn now to the regular afternoon briefing on COVID-19. And while we wait for that to commence, here is a quick look at the prevention protocols for the public under Level 2 of the social distancing guidelines, which have been imposed for the next 2 weeks in the capital Seoul, Gyeonggi Province, and Incheon. Indoor gatherings of more than 50 people, as well as outdoor gatherings of more than 100, are banned. The briefing, I hear, is about to start, so we'll come back to you afterwards.
권준욱 부본부장 설명이 있겠습니다.
Let us now begin our regular briefing for August 20th, Thursday, on the COVID-19 response here in South Korea. As of today midnight, we have 276 new local infections and 12 new imported cases. The total caseload now stands at 16,346. 57 more people have been discharged following full recovery, while a total of 1,976 people are in quarantine. There are 12 patients under severe or critical conditions. We also had one additional fatality yesterday and another fatality as of today, and we have a total of 2 new additional fatalities. We extend our deepest condolences to the deceased and the members of the bereaved family. As for the person who passed away today, this person has also been diagnosed and confirmed with the virus at about 11:20 a.m. and also passed away while waiting to be administered at the hospital and had chronic illnesses as well. Here are some updates on our domestic cases by region. First of all, in Sarang Jail Church in Seongbuk-gu District, Seoul City, we are conducting our contact investigation. 53 more people have been confirmed, and a total of 676 people have been confirmed to date. And in relation to the Sarang Jail Church, the additional locations which have secondary transmissions were a total of 13, and they had over secondary and tertiary exposures of the virus, and a total of 67 people have been confirmed from these secondary infections. And a total of 150 venues, to be exact, that have become infections stemming from these church were also under investigations. And they include 3 religious centers, and most of the offices, which is 5, was the call centers. And next, we have some updates on our August 15th Liberation Day rally, and we have additional cases, 8 of them, and they are also among them. Now we have 18 cases that are not related to the Sarang Jail Church. And in relation to Hyundai Commerce Seoul Gangseo branch and Daegu Suseong-gu District, we have 2 cases, and a total of 19 cases have been confirmed. And in relation to a sports academy in Seongbuk-gu District, we also have additional of 17 patients being confirmed. In total, we have 18 cases. And in relation to a call center in Mapogu District, we have 7 additional cases as of now. And in relation to a family in Songpagu District, we have 8 people being confirmed. And in relation to Prugio Daycare Center in Gangdong-gu District, we have a total of 8 people being confirmed to date. And now moving on to Gyeonggi-do Province, in relation to Uri Jail Church in Yongin City, Gyeonggi-do Province, we have 11 additional cases. In total, we have 165 cases, and 3 more cases have been confirmed in relation to the Starbucks at Paju City, and a total of 58 cases have been confirmed. We have a new cluster in Anyang City centering around a restaurant. 13 people have been confirmed to date. And in Gwangju City, related to nightlife entertainment venue in Sangmu-gu District, we have 2 additional cases. In total, we have 21 cases to date. And moving on to the Chungcheongnam-do Province in Cheonan, centering around Cheonan Dongsan Church, we have 5 cases, and we are conducting investigations, and we have additionally confirmed 2 more family members and 2 few more worshippers. And especially for all of the members of this church are getting tested right now.
저희 중앙방역대책본부에서는 매일
The
보도자료를
KCDC
통해서 검사
also
통계를
publishes
말씀드리고
on a daily
있는데
basis
검사
the
건수
results
자체가
of
5월 이후 평균
the
하루에
diagnostic testings.
9,948건이고
And as of
일일
late
평균
May,
양성률은
we also had about
0.55%입니다.
900
이러한
cases,
일일 검사
new
건수는
cases of
집단감염 발생 시
diagnosis on a
역학조사에
daily
따른 검사
basis,
대상 인원
and
변화에
the
영향을 받고
infectious
있고
rate stands
주말에는
at about
민간병원 휴진에 따라 대체적으로
0.8%.
검사량이
And we
감소합니다.
have seen that there
특히
has been a
최근 국내
decline
발생
during
확진자가
the
증가하기
weekend
시작한
as
일주일 평균
the closure
검사
due to the
건수는
closure of private academies, private
11,312건입니다.
clinics that is, and we also had about
특별히
over
8월 20일
12,000
8월 19일
cases of
18,000건
diagnostic
등이
testings recently.
기록되었습니다.
And in recent days, we
최근
also have
일주일간
about
일일 평균
17,000 cases as well. And during the past 2 days, our infection
그
rate
양성률은
increased to
도리어 검사 건수가 가장
2.2%.
낮았던 8월
And
16일이
this was
4.30%.
actually also surged
건수가
to
높은 8월
about
17일이
4.1% on 16th of
18일이
August, when we had a relatively lower
검사 건수가
number
많다고
of
해서
diagnostic
양성률이
testing.
더
So
높이
we
올라가는
want
양상은
to
보이지
say
않고
that
있습니다.
we do not have a higher rate of infectious rate
최근
even
2주간
when we have higher
국내
numbers of
집단
diagnostic
발병이
testings.
68.1%를
During the
차지하고
past 2
있고
weeks, we
조사
have
중
found
사례
that
비중이
cluster infections in domestic
14.7%로
transmissions
높게
account to
나타나고 있습니다.
68.1%,
지역사회
and we
확산
also
우려가
have
지속되고
14%
있다는
of our
반증으로
cases that are under
적극적인
investigation,
검사의
which
중요성을
shows and testifies that we have a
이러한 선제적
large
검사를
increase in the
통한
number
감염
of
확산
domestic
방지를
cases.
위해서
Therefore, the
발열,
most
호흡기
effective
등의
prevention
증상이
measure
있거나
is
또는
to get
방역
tested
당국의
as
안내에
soon as
따라서
possible.
검사를
And you
받도록
also need to get tested
요청받으신
if you
분들은
have symptoms like a
조속히
fever or
가까운
respiratory
선별
symptoms.
진료소를
And
방문하여
in
빠짐없이
accordance to the
검사를
guidelines given
받으시기를
by the
바랍니다.
KCDC, you need to get tested if we
다음으로 해외
ask you
유입은
to do so.
12건으로 이 중에는
Today we had
유럽이
12 new
4건,
imported
미국이
cases, 4 from the
3건 등이
Europe
있습니다.
and 3 from
연구
the
개발과
US.
관련해서는
And as for
내일
our R&D,
코로나19
tomorrow
치료제
we
백신
will
개발
have
범정부
a
지원회가
pan-government
개최가
committee
되고
on the
특별히
development of
코로나19
vaccines and
백신의
therapeutics,
도입 및
and
예방접종
we
전략
will
등에
also
대해서도
discuss some
논의가 이루어질
strategies and
예정입니다.
policies in regards
또한
to access
지금까지
to vaccines
코로나19
going
혈장
forward.
치료제
And
개발과
right now we
관련하여
have been
총
developing our
1,209명의
blood
완치자가
plasma
참여 의사를 밝혀주셨고
therapy,
실제
and
893명의
total of
분이 혈장을
893 people have donated their blood samples,
자들과
and
혈장을
that we have
제공해주신 모든 분들께
more people
깊이
who have
감사드리면서
expressed their intention to do so. We would
녹십자의
like to
혈장
thank you once
치료제는
again for
오늘
your
8월
efforts.
20일
And starting from today,
식품의약품안전처에서
the
임상 이상
Ministry of
시행
Drug
계획이
and
승인되어
Food
향후
Safety, they said that
6개
the
의료기관에서
GC Green
코로나19
Cross will be
환자를
beginning
대상으로
their
안전성
second
및
trial
유효성
of the blood
시험이
plasma
이루어질 계획으로
treatment.
있음을
And we will
말씀드립니다.
testify the efficacy of
다음으로는
this treatment
생활방역과
going
관련된
forward. And as
사항입니다.
for the life treatments,
수도권
life
지역이
quarantine measures,
사회적
we have
거리두기
a
2단계
few
조치가
announcements.
최적기에
The level 2
국민
social
행동
distancing
지침을
has been
철저히
put in
이행해
place
주시기를
for the
거듭
metropolitan area,
부탁드립니다.
and we ask for
의료기관의
your
방문,
stringent
또
compliance
상품구매나
to these
출퇴근
measures.
외에는
And aside from
불급한
the
외출,
essential
모임,
visits and
행사,
outings
여행
like going to grocery
연기하거나
stores
취소해
and going
주시기
to
바랍니다.
work, as well as going to
음식점이나
hospitals,
카페
please refrain
방문하여
from making
식사하시기보다는
non-essential
포장이나
outings
배달
and
음식을
gatherings.
활용해
And
주십시오.
instead of going physically to
체육시설에
the restaurants and
가기보다는
cafes,
집에서
please
홈트레이닝을
utilize the
권장드립니다.
delivery services and takeout
각종
services as
대면
well.
모임보다는
And please work out at
PC나
home instead
휴대폰을
of going
활용하여
to
각자
sport
집에서
gyms,
비대면
and also
모임으로
work from
대체해
home
주시기
if this is
바랍니다.
possible via
거듭
your
반복해서
computers
말씀을 드립니다만
and your electronic
외출을
devices.
하시더라도 모든 실내에서는
And even when
반드시
you go
마스크를
outside, you
착용해
need to wear
주시고
face masks at all times
실외에서도
if you are at
2m
indoor
거리두기가
facilities.
어려운 경우
And even when
반드시
you are
착용하셔야
outdoors, if
합니다.
you cannot keep 2 meters of
사람
healthy
간
distance,
2m
you
이상
need to wear
거리를
face
두고
mask.
또
There,
각종
we have also
침방울이 튀는
seen
행위는 하지
that
말아주십시오.
there were
예를 들어서 소리 지르기,
activities
큰
like
소리로 노래
chanting and
부르기,
shouting and
응원하기
singing
등입니다.
and
또한
cheering
신체 접촉도
at
하지
outdoors
말아주시기
with
바랍니다.
2 meters of distance.
악수
However,
대신에
this shall not
몸위로
be
해주시기
carried out as this
포옹 등
increases the
신체적
respiratory
접촉을
droplets
삼가해
travel
주시기 바랍니다.
infections. And please
환기가
refrain
잘
from
안
making
되고
physical
사람이
contacts
많은
like hugging or
밀접한
handshaking.
장소는
And also,
가지
please do not
말아주십시오.
go to too
특히
crowded, closed,
열이
and
있거나
close
호흡기
contact
증상 등 몸이
environments.
조금이라도
And especially
이상하면
if you feel
외출,
ill
출근,
and if you
등교하지
have
말아주실
symptoms
것을
like fever
요청드립니다.
or respiratory symptoms, do
아직은
not go to
거리두기가
work or go
2단계에 이르지
outside.
않은 다른
Right
수도권
now,
이외의
we also
다른
have
지자체
social
주민들께서도
distancing measures which are not at the level of true as many of other provinces. However, as we have possible risk of further infection, we ask you to abide by similar measures as
또한
well.
어제도 말씀을 드렸습니다만
And we
수도권
mentioned this
지역의
yesterday.
모든 교회에
However,
대해서는
we want
이미
to make
집합
sure
제한
that
명령이
the administrative
시행되고
order to ban
있습니다만
the gatherings for
수도권의 교회와
religious
관련해서도
centers
타
in the
지역으로의
metropolitan area
수련회,
have all
기도회
be
등도
banned.
당연히 하지
And
말아주실 것을
you should also
부탁드리고
ban
또한
all of church
확진자가
retreats
발생한
and events that are
일부
held in
교회의
other
교인 및
provinces as
확진자가
well. And
전국적으로
we also
분포하는
have seen
전국적
that
확산이
there are
우려되고 있기
church
때문에
members who are
비수도권
dispersed
지역의 모든
throughout the nation.
교회에서도
So we ask
온라인
all
예배로
of the religious
전환하는 등
facilities and
수도권에
all
준하는
of the
조치를
churches
취해주실 것을
nationwide
요청드립니다.
to refrain from having
마지막으로 몇 가지
meetings
부탁
in person.
말씀드리겠습니다.
We have
지금의
some
코로나19
recommendations and
상황에
advices
대해서
for the public.
말씀드린다면
As
수도권
for the current
곳곳에서
trend
감염
in
확산이
South Korea, we
나타나고
are
있습니다.
seeing sporadic
특히
outbreaks in the
지난 8월
metropolitan area.
초부터 증상이
Starting from
나타난
early August, we had some symptoms, and these clusters stemming from the Sarang Jail Church. It is very important for us to track down these potential patients and to curb the further spread of the virus throughout the community, whether they be secondary and tertiary. So this is a very crucial moment. We believe that until this weekend, we are at a critical juncture, and at the same time, we are conducting our epidemiological investigation. And we have found that as for the people who were at the Liberation Day rally, there have been people who are linked to the religious facilities. However, we have also seen some patients with unidentified sources of infection. So therefore, the quarantine authorities would like to note that together stemming from the Sarang Jail Church and also stemming from the Liberation Day rally, this could also act as a further source of infection. And we have been noting that many of the attendees gathered from all over the country through large buses, and we believe that these could spark and ignite further transmissions, and this could also ignite nationwide transmissions as well. And therefore, we would like to ask all of the local authorities to cooperate with us in curbing and stemming the disease as well. And our efforts will also yield results starting from this weekend. And our effects of the social distancing that has been put in place earlier this week, we believe that this is the ultimate aim for us to have these measures to yield results at a fast rate. However, currently the infections nationwide are at a very critical moment and severe moment. And we mentioned this multiple times. However, we are very worrisome about the silent spreaders who have unidentified sources of infection. However, the ratio of these people are increasing on a daily basis. So the worst case scenario is a large-scale outbreak in the metropolitan area and also other infections spreading in other parts of the country as well. Until this weekend and until the time to come, if we fail to identify and we fail to track down on these patients, our situations could be similar to those seen in other countries like the US and many countries in Europe. Please note the seriousness of the situation here in South Korea, and also have trust in the recommendations given by the government, medical practitioners as well, and please abide by them as well.
참여하는
And
것만이
please participate in
현재
our
유일하고도
quarantine
가장
measures, including
강력한
distancing and wearing
코로나19의
face mask,
대응
because
방법으로
these are the
앞으로의
most
피해를
effective
최소한으로
measures
줄일
in
수
curbing
있는
the virus
유일한
going
대안입니다.
forward and to minimize further
마지막으로
damages
지난
and losses.
광화문 집회에
Last but not
참석하셨던
least, we would like
분들은
to urge all
지금
of the
즉시
attendees
가까운
who have
선별
attended
진료소에
the Liberation
가셔서
Day rally that was
코로나19
held in
검사를
Gwanghwamun
받아주십시오.
Plaza to
추가
get
전파를
tested as
막아야
soon as
합니다.
possible. We
또한
need
주변에
to
건강이
curb
약한
further
분들을
spread,
보호해야
and
합니다.
we need to also
저희
protect
방역
those
당국의
who are
절박한
weak.
호소에 귀 기울이시고
So please listen
빨리
to our
검사
urge and
받으시고
appeal,
거듭
and
요청드립니다.
please go to the
이상입니다.
screening clinic to get tested. Thank you very
지금부터는
much.
기자님들이 온라인으로 보내주신 문자 질문.
Right, that was Kwon Junuk, the Vice Head of KCDC, with Thursday's afternoon briefing. For more on the gist of that briefing, today I have Dr. David Kwak from Suncheon University Hospital joining us as well. Welcome, Dr. Kwak.
Thank you.
Right, so first to give us a summary of that briefing.
All right. Well, Kwon Junuk, the Vice Director of the KCDC, stressed that we are at a critical juncture right now, and that this weekend, until this weekend, we will see whether the social distancing measures at level 2 will bear some fruit and in preventing a second wave of the pandemic. And we have another 53 new cases related to the Sarangjeil Church in northern Seoul, raising the total there to 676. And also there are some 13 new locations where secondary infections or even tertiary infections have occurred related to that church. In fact, 67 cases there. And because of that, the government is also doing epidemiological studies on some 150 locations, which include call centers, medical facilities, as well as academies. So it really looks like these nth transmissions are what's keeping authorities on high alert right now, right, Dr. Kwak?
That's correct. Something that we have to be careful for is that these secondary and tertiary spread of the virus, it grows exponentially. So these are not linear fashion that the numbers are growing, such as in 100 and next 230, 300. It's going to grow in tenfolds of the numbers. So that's something we have to really closely watch for. And some of the measures that we have to take is obviously physically blocking this physical context between people. So with the cluster infection of the church, we would have to keep a very close eye on this matter.
Right, I'd have to agree with you. All right, Dr. Kwak, stay with us for more at our studio session. And Soa, thank you for that. I'll see you again tomorrow.
See you tomorrow.
The number of infections cases we see day by day are not slowing down.
Many countries that believed they were past the worst are now grappling with new outbreaks.
지난 8월 15일 이후 일주일이 채 안 되어서 1,000명이 넘는 확진자가 발생하였습니다. 지금 차단이 하루라도 늦어진다면 또다시 증폭되어 대유행을 불러올 수 있다는 위기를 반증을 하고 있습니다.
정부의 이번 강화된 사회적 거리두기 조치는 나의 일상을 지키고 사랑하는 가족을 지킬 수 있는 마지막 선택이라는 점을 꼭 기억해 주시기 바랍니다. 이번 조치의 안전선이 무너지면 우리의 선택지는 더 이상 없습니다.
The world is witnessing a resurgence of COVID-19, and quite a number of countries, including Korea, have reimposed restrictive protocols in a bid to curb the latest spread. For more on the situation here and abroad, I have Director Kim Moon-gyu of the ODA Center at the Yonsei Institute for Global Health. Hello, Director Kim.
Hello.
I still have with us Dr. David Kwak, of course.
Thank you.
And from the US, I have Professor Park Ki-bom from Harvard Medical School live on the line. Hello, Professor Park.
Hi there. Thanks for having me.
Thank you for being with us. Director Kim, my first question will be to you. As of last Friday, Korea has recorded more than 1,500 new cases. Are we marking the start of a second wave?
Well, according to the epidemiologist, they say there is no formal definition of a second wave, but they say they know when it happens. So right now, I'm afraid, I hope that this is not the second wave right now. When we consider that, this might be just a repeated outbreaks instead of secondary wave. But we have to be vigilant, and according to the Spanish flu 100 years ago, the secondary wave happened at the season of autumn. So if we consider the viral factor, we have to continue to be cautious about this phenomenon. But right now we cannot be safe, and every time we see the increase of the confirmed cases, there are more things we have to consider. The population size, how many tests we have did it, and the positive rate. So we consider all these together, and then we might make some conclusion, but it's still in caution. So yeah, we have to keep on this
watching the situation then.
Yes.
Dr. Kwak, health officials claim the latest outbreak right now is much more severe than that we observed in Daegu, the epicenter of Korea's first outbreak. What is the reason behind this claim?
Well, we can focus on the population of the size of the city. Sarangjeil Church happens to be at the center of probably the most populated city handful in the world. And also it's targeting many of the elderly, majorly. Also, it's already showing secondary and tertiary infections. As we said before, we've already discovered 11 to 13 possible secondary tertiary infections spreading around. More than number, obviously, more of the more severe illnesses are going to come out of. So we have to really stay vigilant. And as the KCDC is claiming, we have to stay vigilant. And this week actually might be the verge that we have to come over to mitigate the virus.
Director Kim, medical experts are also claiming that the rate of transmission this time around is disturbingly rapid. Please tell us more.
Well, when we say about the infectivity, there's a conception reproduction number. And we had SARS in 2002, and if we compare with SARS and MERS and the COVID-19, I think SARS had the higher reproduction number, and second might be COVID-19, and MERS might be the third one. But right now, there are many controversies, and if you have new mutations, that number will change. So there might be also some regional differences, and what kind of people are exposed, what was their situation, and if we have a new mutant, this reproduction number might change without our expectations. So we know that D614G mutation is causing more infectivity, but the good news is it's not that lethal. I mean, they don't increase the mortality rate. So since 2 weeks, I think the reproduction number is more than 2.8, which is very dangerous. If we leave it like that, just as Professor Kwak mentioned, it's going to be exponentially spreading. So that's the thing we have to consider.
Right. Let's turn our attention to the US now. Professor Park, we mentioned this at the start of the program, but COVID-19 stands as the third leading cause of death in the US, just after heart disease and cancer. What do you suppose is the reason behind the alarming number of fatalities from COVID-19 in the US?
Right. The US does have the highest number of COVID-19 cases in the world. So it has over 5.5 million cases. And of the 785,000 deaths worldwide due to COVID-19, 170,000 of them, 22%, are American deaths. I want to point out that the population of the US is only 4% of the world. So the horrendous and the disproportionate impact the COVID-19 is having on the US is completely unexpected. So why is this happening? It's certainly not because the U.S. doesn't possess the necessary technical capabilities or the financial resources to handle the pandemic. We're the richest country in the world and some of the best medical care anywhere. In fact, prior to the current pandemic, the U.S. was ranked number 1 by the Global Health Security Index, suggesting that we're the best prepared. So in my opinion, there are 3 main reasons why we have such high number of deaths. The first is the failure of leadership. The U.S. government failed to mount an effective all-of-government response to COVID-19. It began with the Trump administration not taking the threat seriously. They wasted precious time that could have been used to ramp up testing and treatment capacity. Then the Trump administration shifted the responsibilities for developing social distancing policies to state and local government. We cannot fight a global pandemic with each town and state trying to figure out what to do next. We need a strong and effective leader, but we don't have one right now. The second is the politicization of the COVID-19 policies. The U.S. is currently politically polarized into 2 groups. One group is saying that we need to first protect the people by controlling the virus. But we have another group saying that the economy should be the priority. And so this group pushes for early reopening of schools and businesses and would like to see masks become optional rather than mandatory. These groups are unfortunately fighting each other, which prevents a unified approach to controlling the virus. And the third and the last reason is the privatized and fragmented healthcare system in the U.S., with thousands of insurance plans and patients having to bear a portion of the medical costs, sometimes all of it. So many people may not seek care when they need it, let alone go for a test out of financial fears. Further, such a fragmented system makes implementing a nationwide testing program virtually impossible. A privatized health system is completely inadequate in the face of the pandemic.
Staying with that grim reality of mortality, Dr. Kwak, back here in Korea, compared to the outbreak triggered by the church in Daegu, that triggered by the church in northern Seoul has led to a greater number of elderly patients. And this has raised concerns about a sudden possible surge in the death toll. What are your thoughts on this?
Well, you just said it. We are very concerned because with the increase of the patient's age, the increments also increase. Meaning the older they get, not only they grow in sizes of the severity and the case numbers, they actually grow even more further. So if we compare patients, the case numbers of people between 40s to 50s, then 50s to 60s, and 60s to 70s, we're not going to see a linear increase in the numbers, but we're actually going to see increase in the increments of the number. And that also means that more people at the older ages is going to be possibly admitted to intensive care units. They're going to need further mechanical ventilators, and possibly they would end up dying even more. So we should be very concerned. We should be very vigilant at this moment.
Right. Director Kim, if you have any questions for Professor Park over in the U.S., please go ahead.
Okay. Professor Park, nice to see you again. I think I met you last year. Yeah. I heard that the United States, they are opening the school in this autumn, and still they have clusters of infections. How do you think that's serious or not?
Right. So some of the schools have actually already opened. So here's once again a failure of clear leadership and guidance from the federal government, such as the CDC. My wife works on local government at Brookline in Boston, and they're having to make, each township having to make their own decisions on whether to reopen or not. And this is not a good way to do this. So my daughter, I have a daughter in college, she just left for college yesterday. And my youngest daughter, who's a 6th grader, she thought she was going to a hybrid type of reopening. Now they just changed that policy to a completely remote system in Brookline. And I just want to point out 2 incidents that I think was in the news. One is the University of North Carolina in Chapel Hill. They just closed their campus for the rest of the semester. And this is after being open for just 1 week. And University of Notre Dame, similarly, they suspended classes for at least next 2 weeks after an outbreak among students. So based on these cases, I think most schools are now going to a remote type of learning for the fall semester. Harvard has gone to a hybrid system where they invited the freshmen and seniors to come back to campus, but sophomores and juniors to stay home. So We need a comprehensive federal government leadership, and that's the huge vacuum that's missing right now. And they need to implement a comprehensive nationwide testing and contact tracing program, something that's really not likely to happen soon. And the schools will continue to struggle with trying to provide full educational experience on one hand, and at the same time ensuring safety for their students and staff.
As Professor Park just mentioned, here in Korea, a hybrid academic approach is being recommended under level 2 of social distancing measures. Director Kim, do you believe that these measures, which also restrict the size of gatherings here in Seoul, Gyeonggi Province and Incheon, as well as the closure of businesses at buffet restaurants, nightclubs and cram schools that have more than 300 students, do you believe these prevention protocols will be effective in curbing the latest spread?
Yeah, I do believe that somehow it's going to be effective. When you look at the guidelines, you see that they define the group size, and they mention about the indoors and outdoors activity, and even they categorize to low risk, middle risk, and high risk. So, but these kind of measures should be combined with the response from the population. So I hope that the general population will try to find some more healthy habits and avoid heavy drinking or smoking. And if you think you have some health issues like some high risk factors, you better be more cautious, even more higher than the level guided by the government. And the longer we put this guidance, it's going to have some unwanted effects like bothering in this normal lifestyle and economics and education. Everything is going to be affected. So we should put our energy and focus for this few weeks, and then I hope that we can go back to level 1.
Right. Dr. Kwak, do you have a question for Professor Park?
Yes. So I would like to ask that I heard some of the churches or religious groups in the U.S. are actually continuing to conduct their worship services despite local authorities' regulations. And what measures are taken by the U.S. government currently to regulate activities of the religious group?
Right. Unfortunately, the issue of church gatherings in the face of COVID-19 pandemic has not been settled in the U.S. Actually, some churches are suing to challenge the local governments. So there's a political dimension to this as well. The federal government, in other words, the Trump administration, is certainly not discouraging large church gatherings, which is something they should be discouraging. And some of the more conservative states have actually named church gatherings as essential services during the pandemic. So I understand that people's need to worship. I'm a Christian myself, but everyone must do their part to mitigate community spread of the virus by strictly adhering to social distancing measures. The sooner we get the virus under control, the sooner we can all go back to our churches.
I have to agree. Dr. Kwak, there are mounting concerns over the after effects of COVID-19. I understand that extensive research is required, but what can you tell us about some of the more common conditions after recovery?
So we just saw on the news yesterday a case of Professor Park Hyun, who is affiliated with Busan University. He's a past COVID-19 patient who's recovered now, but he's explaining some of the symptoms that he's going through. So I'm going to lay out what he's going through right now. He's currently having a brain fog, so he's hard time thinking in his head. He's also having some remaining chest pain. He's having abdominal cramps and some general weakness that's remaining, as well as sometimes difficulty breathing, especially in the more active situations. And also he's still getting discolorings on the skin, especially on the fingers and whatnot. So despite COVID-19, the virus, when you even recover from it, there are some of the things that can remain in your body for the lifetime. So we should definitely be careful about the virus currently.
Those lingering conditions are quite disturbing. Professor Park, what can you tell us about the repercussions of COVID-19 after recovery in the U.S.?
I'm a surgeon. I don't know if you knew that, but I don't treat COVID patients directly, so I don't have too much to say about the after effects of the COVID patients.
Director Kim, some observers believe that complacency then is to blame for the latest outbreak given the prolonged pandemic. Perhaps you could take this moment to highlight some of the dangers of the disease.
Well, I just want to put some hypothesis about the risk group. If you're elderly, you have a high risk to catch it, and even though you recover it, you're going to have some time after the infection. And if you're obese, if you have some lung problem, heart problem, if you're diabetic, and those kind of risk factors, if you have it, you really have to be cautious and not to catch it. And even though you catch it, the recovery time is going to take some time, and you might have some sequelae. So please be cautious in these high risk groups.
Right. Professor Park, one very brief question. Authorities in Malaysia recently detected a mutation of COVID-19 virus that is reportedly 10 times more infectious than the original strain. How are researchers in the US involved in the race for a vaccine or cure responding to such findings?
Yeah, so there are 7 companies in the US currently working on the COVID-19 vaccine. And I'm sure they're aware of this strain and will try to develop a vaccine that provides protection to the new strains as well. And I want to add that in the area of vaccine development, U.S. companies with billions of dollars in financial backing and facilitation from the U.S. government, the FDA, and Health and Human Services, they're at the leading edge of vaccine development. This unprecedented initiative is called Operation Warp Speed. It's one of the bright spots for the U.S., and I hope they succeed in bringing a safe and effective vaccine to the market. You know, my concern has to do with who will be getting the vaccines first. I'm glad you showed a segment at the early part of your show with Dr. Tedros from the WHO Director General talking about equitable distribution of vaccine. And I worry if the vaccine is owned by a private company, you know, how equitable it will be.
All right, Professor Park, all the way in the US, thank you very much for your thoughts. Dr. Kwok, thank you as always for being with us. And Director Kim, thank you for your thoughts as well.
Thank you.
Right, well, it's time to say goodbye now. Do stay safe and join us again tomorrow at this hour as we review prevention protocols and contact tracing efforts as the first steps to stem the spread of COVID-19. Thank you for watching.